On this particular day, I was very shocked when a subscriber asked me, Nurse Mary, can you please talk about buried penis? I'm like, what? Does buried penis exist? What do they mean when they say buried penis? If you are just hearing this for the first time and you are shocked, that was exactly how I felt when I heard about buried penis. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be talking about buried penis. Are we talking about burial? Oh, no, buried penis. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mary saying thank you. Let's go there. All right, welcome back. So the first question is, what is a buried penis? What do you think it is? Okay, I'm going to tell you. A buried penis is a condition in which the penis is hidden inside the fold of skin in the thigh or in the belly or in the scrotum. Just assume a man's penis is hidden, is buried, is hidden inside the thigh, is hidden inside the belly, is hidden in the scrotum. And this hiddenness cannot be uncovered. That is what we refer to as a buried penis. And the funniest thing is that this can be present at birth and it can also develop at any age. For those that have not experienced it and have not heard about it, to them it's like, it's weird. What can cause it? What could be the cause? I'm going to be telling you some causes of a buried penis. So the first one I have to share with you is previous surgery. If you've done some previous surgery in the scrotum, in the penis, and this surgery is leaving scars behind, that can result in a buried penis, in the sense that this penis is hidden beneath the scars. So that's the first cause. Then the second cause is some abnormality, some birth abnormality that are present at birth. Birth abnormality, yes. So when it comes to the birth abnormality, we're talking about the ligament. So when the ligament that holds the penis is weaker, is not strong enough, is not as strong as it should be, definitely there's going to be something called the buried penis that might take place. Then the third cause of a buried penis is high BMI, obesity. So when the BMI of a man is above 40, they might have a buried penis. For those that are asking, how do I calculate my BMI? This calculation is for both the male and the female. So when you know how to calculate your BMI, it helps you understand the fact that, oh, am I obese? Am I underweight? Should I eat more or not? So it gives you a clue of where you are. So to calculate your BMI, just go to Google, say BMI calculation, you impute your height and also impute your weight. You are able to get your BMI and know if you are overweight, obese, and if you are okay, you are normal. So when you have high BMI, it can make your penis looks inverted. It can make your penis looks buried. So that's also another cause of buried penis. Then that takes me to the other cause, which is lymphedema. Yeah, I don't know if I'm pronouncing it well, lymphedema or lymphedema. So, but you can see the spelling on the screen. So lymphedema is one of the cause of a buried penis, and this happens when there is a collection of fluid, collection of pus in the scrotum, making the scrotum swell, and that can make the penis to be hidden. That can make buried penis to happen. So these are the various causes of buried penis I have to share with you. And the next thing that comes to your mind is, how do one know that he has a buried penis? What are the complications of having a buried penis? In terms of the complications or the signs that these men or these boys show when they have buried penis, one of it is that they find it difficult to pee while they are standing and while they are sitting without having some drops of urine in their clothes, in their ties, in their boxers. So whenever they want to pee while sitting, while standing, they tend to have some drops of urine in their boxers, and that can really be annoying to them. Now that takes me to the second sign, which is hygiene issues. They might have difficulty in the sense that whenever they pee, they get urine drops on their boxers, on their ties, and they have to go and change their clothes to wash up again just to get those smells and odor out of their body. that, you agree with me, is really stressful. Then the third thing is that these people are prone to urinary tract infection. They are prone to infections because when they pee, there's a drop of urine in their thighs, in their boxers. There's also a drop of urine in their pants and all around their body that can easily prone them to what? To recurrent UTI. For the uncircumcised men, the cover of the penis, that is the top, might get inflamed. And also, gaining erection, having erections might be difficult for men with this buried penis. And even if they have erections, this can be really painful for them. And also, let's not forget that when they are experiencing these things, low self-esteem is going to step in. They're going to feel less of themselves, especially when they come in contact with their partner, with their spouse, and they're unable to have erections because during erections they're in pain, or they are frequently having UTIs. That can lead to low self-esteem. That can make them want to isolate themselves. That can make them not to associate or have partners or anything relationship to do with other people because they are shy and they don't really know how to explain what is actually going on with them. That can cause depression, that can cause anxiety, that can cause a lot of psychological issues for the men battling with this buried penis. So these are the signs and symptoms that I say that these men kind of experience. Then in terms of diagnosis, how do doctors know that a man has a buried penis? Visual and physical examination is going to show that a man has a buried penis. So when they visit the doctor after experiencing these various signs I just listed, the doctor tends to examine them visually and physically and make a proper diagnosis that, oh, this could be a buried penis. Then that takes us to the treatment for buried penis. We can actually pinpoint and say this is the particular treatment for a buried penis. The treatment actually depends on the cause. What is actually causing this buried penis? What can we do about it? For children, as they grow older, it might just go off and they tend to have their own normal penis. But for adults, most times they might get themselves involved in surgery to get it sorted out. There are a lot of surgeries that can be done. We can say this is a particular surgery that can be done. So when the cause is taken note of, that gives an idea to the doctor on what particular surgery to help out with the buried penis. So fat can be removed from the abdomen, fat can be removed from the thigh area, fat can be removed depending on the location. Liposuction can be done, grafting can be done, especially when the fat has been removed and there's a lot of surgeries down there. So I am not a doctor, I'm just giving you an idea of what can be done. Surgeries generally can be done to help people with buried penis. So if you portray these signs and symptoms I just showed, these complications I just showed, you can speak with your doctor to give you a better idea on what particular surgery to be done or what particular help that can be done to help you do away with this buried penis. In terms of surgery, the complications that are likely going to arrive from surgeries involving this buried penis is wound infection. We all know infection. As far there's an opening, as far there's an incision, definitely one of the complications or one of the risks is actually infection. But that doesn't mean if you want to go for buried penis surgery, you should not go for it. So what I would advise, if you are battling with this, you're having infection, your doctor is going to prescribe some antibiotics, some medications to help with the urinary tract infection. And if the buried penis is as a result of some weight gain, you can try as much as possible to see if you can do a weight loss journey, embark on a weight loss journey to help lose weight so the buried penis can actually pop out, or you can go for a liposuction or the surgery that a doctor advised you at that particular moment. So this is what I have to share with you about buried penis. You see, your questions kind of give me an opportunity to read and also learn. Yeah, because I personally never knew there was something called buried penis. See, I saw the question, I had to go and read, and I found it interesting, and I decided to come and share with my subscriber. So for the person that asked this particular question, I believe that your question has been properly answered. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.